The mind is everything. What you think, you become. Hope you all are safe and at home. Welcome back to our channel. Today's lecture is on verrucous carcinoma, which is a very important topic. So watch this lecture carefully. Introduction to the verrucous carcinoma. It is a warty variant of oral squamous cell carcinoma. It is an exophytic cauliflower-like growth with a well-differentiated keratinizing epithelium showing minimal atypia. There are locally destructive pushing margins at the interface of the epithelium with the connective tissue. Verrucous carcinoma show distinct clinical and microscopic features, and it has a unique mode of behavior. Now, this you can see a clinical classical picture of an exophytic cauliflower-like warty growth of verrucous carcinoma. Now, the epithelium in verrucous carcinoma is well differentiated. It is hyperplastic, stratified squamous epithelium with bulbous retipegs. The retipegs are bulbous, and there is no atypia and minimal mitotic activity in the epithelium. There is an endophytic component of the verrucous carcinoma epithelium, that is, the invading margins, they appear below the level of the surrounding mucosa. This is the endophytic component of verrucous carcinoma. Now, the epithelium shows deep surface invagination which are filled with keratin. The advancing epithelium border is broad and the basement membrane is intact. Remember here, the basement membrane of verrucous carcinoma is intact. Now, the connective tissue shows heavy chronic inflammatory cell infiltrate. There is local destruction of the connective tissue beneath the epithelium. The growth of the tumor is slow and the rate of metastasis is rather late. Now, here you can see the bulbous retipegs, intact basement membrane, and deep folds in which the parakeratin is plugged. Now, verrucous carcinoma, it characteristically turns aggressive upon irradiation. Now, there is a different terminology. What is verrucous hyperplasia? Let us see what is this. Verrucous hyperplasia is an exophytic overgrowth of the well-differentiated keratinizing epithelium. It is similar to verrucous carcinoma but without destructive pushing borders. So, in verrucous carcinoma, the borders of the lesion are destructive and pushing, while in verrucous hyperplasia, the borders are not destructive and not pushing. So here you can see the classical picture of verrucous hyperplasia. Now, the clinical features, it occurs mostly in elderly of the age range 60 to 70 years. Males are affected more than the females, and the most common site of occurrence are buccal mucosa, gingiva and the alveolar ridge, while the palate and floor of the mouth are affected in rare cases. So, verrucous carcinoma clinically is an exophytic papillary pebbly lesion often covered by a leukoplakic film. The rugae-like folds are present with deep clefts in between the rugae. So, here you can see a picture of verrucous carcinoma on the tongue. The etiology of verrucous carcinoma is heavy tobacco use. Now, the histopathology, there is marked epithelial proliferation, downgrowth of the epithelium in the connective tissue. The epithelium is well differentiated with minimal mitotic activity, minimal pleomorphism and minimal nuclear hyperchromatism. There are cleft-like spaces which are filled with parakeratin, characteristically known as parakeratin plugging. The lesion is extensive with intact basement membrane, and often there are focal intraepithelial abscesses found which can be related to infection. Chronic inflammatory cell infiltrate can be seen in the connective tissue. So here you can see hyperplastic proliferative stratified squamous epithelium with parakeratin plugging, intact basement membrane, bulbous retipex, chronic inflammatory cell infiltrate in the epithelium, and there is growth of the epithelium into the connective tissue. Now the treatment and prognosis: precise surgical excision is needed. Irradiation may cause anaplastic transformation of the verrucous carcinoma, but the prognosis of the lesion is good. The next lecture will be on malignant melanoma. Hope you are liking our lectures. If yes, please hit on the thumbs up icon. That's all for now. Happy study.